My name is Adler. My specialty is podiatry, but in particular I do a lot of diabetic limb salvage and foot and ankle reconstruction. I practice in Ocean Township, New Jersey, and the name of my practice is Barefoot and Ankle. I was first introduced to SomaGen mesh in the operating room. Perform a lot of diabetic limb salvage operations where we have a soft tissue deficit. Sometimes we have to close over bone or tendon, and we're trying to grow tissue. Historically, there's not anything that has been known to be healing over bone. So I started using SomaGen mesh over large defects that go all the way down to the level of bone. And I was able to use that in combination with negative pressure wound vac therapy in order to essentially grow tissue over top of bone and then heal people who once had to go through further amputation. One of the major, I think, deciding factors for me when choosing a graft is that SomaGen mesh is human cadaveric graft with acellular matrix. Because of the fact that it is human tissue, it's also aseptically processed, so it has the ability to incorporate and bind fibroblasts better than any other tissue out there on the market. Some of the other technologies use various xenografts which will not bind as fast or as quickly as some of the human dermal matrices. So one of the other major, I think, deciding factors for me with the graft selection is also the expandability of it. So we can use more of it and save a cost to both the healthcare system and the patient in the end by allowing that to be distributed over the entire wound bed. I think one of the other most important components of SomaGen mesh is a lot of the competitors out there have a barrier that you cannot see the graft as it's starting to incorporate. So due to the fact that it has a large open lattice, you can allow for fluid to kind of come out of the wound bed into either a wound vac or into the dressing so it doesn't trap moisture in. So I think our failure rates are lower and our infection rate goes down as well because we have no more trapped fluid against the wound bed.